So Roseanne, what brings you in today?
My doctor thought that I should have my eyes tested because I had a minor stroke about a week ago.
Okay, have you noticed any changes to your vision since that happened?
I think my vision's been getting worse over the past year. It seems to fluctuate during the day. I'm not sure I'm safe to drive anymore. I've been told I have cataracts. I'm not sure if that has anything to do with it.
Okay, we'll take a close look at everything today. Before we get started, I'd like to review your health history. Looks like you have a history of breast cancer, depression, anxiety, osteoporosis, and hypothyroidism.
That's correct.
Okay, and for medications, it looks like you're taking Centrum Silver, calcitonin, imipramine, synthroid, and tamoxifen.
Yes, and I've just been put on a blood thinner since the stroke, but I don't know what that's called. I don't know the name of that. And I don't think that my imipramine, or however you say it, is working very well for me anymore. It was prescribed for me in 2015 when I was diagnosed with breast cancer, but since the stroke, I've just had pretty high anxiety.
Well, I'm sorry to hear that you're not feeling very well. I'll confirm the name of the blood thinner with your primary care doctor and also let them know that your anxiety is getting worse even while on the medication. Let's get started with the exam. So to start off, the good news is I'm not seeing any internal signs of damage as a result of the stroke. However, your vision is quite reduced as a result of a few things, mainly the cataracts, but you also have significant signs of dry eye. The cataracts have also progressed to a point where glasses are no longer going to help make your vision any better. You also don't meet driving requirements based off of what I'm seeing today. Luckily, the cataracts can be removed and your vision should significantly improve.
How can I have the cataracts removed?
We'll refer you to a surgeon for a consult to have them removed. It's a very common surgery and I think you'll be very pleased with the results. That being said, I also mentioned the fluctuating vision. That's a result of dry eye. Unfortunately, dry eye is a common side effect to many medications, some of which you're actually taking. And we can't take you off the medications because you need them, but we can manage the dryness. I'd like you to start taking preservative-free artificial tears 3 to 4 times a day, and you can find those at your local drugstore.
Well, it sounds like I shouldn't be driving.
I can refer you to Big Rapid Social Services who can arrange transportation for you until you have the cataracts removed.
Well, that would be great.
I'll have my technician help you schedule an appointment with the surgeon. I'll also send a letter to your primary care doctor explaining today's findings and that we're going to go ahead with the cataract surgery. Do you have any questions?
No, I think it's all pretty clear. Thank you.
I just got a fax from Dr. Kelch regarding Roseanne Smith, who we saw last week. We recommended her to get her eyes checked after her stroke. Sounds like the doctor doesn't think there is any damage following her stroke, but they are recommending she have cataract surgery to hopefully improve her vision. She's currently not a legal driver.
Okay, yep, that seems like a great option for her. Did the optometrist mention anything else in the note?
It also says that she has significant dry eye, and they recommended to use artificial tears at the pharmacy. Plus, they said the patient feels her antidepressant isn't working anymore. She feels anxious since having the stroke.
Do you mind calling over to the pharmacist to verify what medications she's taking and when she last filled them? And then maybe see if any of those medications might be causing the dry eye.
I can do that right now.
Okay, great, thank you.
Yep. Hi, may I speak with the pharmacist, please?
Hi, this is Molly. I'm the pharmacist here today.
Hi, Molly. My name is Evan Dennis, a nurse at Dr. Thompson's office. I was calling in regards to our mutual patient, Roseanne Smith. Dr. Thompson would like to confirm all of her current medications. Last time she said they were filled, and if there are any medications that could be causing dry eye for her.
Sure, let me take a look at her profile here. It looks like she's currently using nasal calcitonin, levothyroxine, imipramine, tamoxifen, and warfarin. And we recently did a medication review with her and she told us that she was taking a Centrum silver vitamin. She fills them all consistently every month, with the last fill being 2 weeks ago, except for the warfarin. That's a new medication, and she just filled that one 3 days ago.
Okay, thank you. That is what we had on file too. Except for the vitamin, what about the medication that can be causing dry eye?
Of these medications here, it looks like it's probably the imipramine that would be causing that.
That's helpful information. A recent note from her optometrist stated that the medication is not controlling her depression and anxiety, and she has significant signs of dry eye. Do you have any recommendations about what she could take instead?
Well, I don't see an SSRI on her medication record here at all. So unless she's tried and failed several medications in that class, then I would recommend an SSRI.
It doesn't look like she has been.
Okay, great. I would recommend either sertraline 25 milligrams once a day or escitalopram 10 milligrams once a day. And I would recommend cross-tapering that with the imipramine. So gradually over the next 2 weeks, decrease the dose of the imipramine and at the same time increase the dose of the sertraline just to decrease any side effects. And if you'd like, I can put a note in her profile to teach her how to do that when she comes in.
That would be wonderful. I'll talk to Dr. Thompson to get her perspective, and we'll send over a new prescription if she agrees.
Sounds great.
One last thing, she is scheduled to have cataract surgery within the next few months, so if you could leave a note in her chart to remind her to stop taking her blood thinner 4 days before she has surgery.
Sure, I'll put a note in her profile and we can talk about it when she comes in to pick up the new antidepressant.
Great, thank you. Have a good day.
Thanks, you as well.
Hi, Dr. Keltz. I'm calling in regards to our mutual patient, Roseanne Smith. I received a letter about her being referred for cataract surgery. I also saw the note about which blood thinner she was taking, and I want to call that over to her pharmacist to confirm. She's currently taking warfarin.
Okay, great. I will add that to her chart. Did you get my note about anxiety symptoms and dry eye?
Yes, I did. The pharmacist confirmed that the imipramine is most likely causing the dry eye, so we'll likely be switching that medication.
Okay, sounds like a plan. Thanks.
You're welcome. Have a good day.
Good morning, Roseanne. My name's Courtney. I'm glad you could make it today. I know you were referred to our agency by your optometrist, Dr. Keltz, but what's bringing you in today?
Oh, a lot of things, I guess. I had a minor stroke about a week ago, and I guess due to that, my vision is really bad, and I feel like I can't drive anymore, which is really hard because, you know, I've got all these prescriptions that have to be filled and appointments to make, and I can't drive myself. My daughter brought me here today, but she works full time and she's not going to be able to drive me all the time. And then I'm having difficulty cooking for myself because I can't read my recipes and I can't see the dials on the stove. I guess I'm just under so much stress now, and I don't have a lot of money for big extra expenses. I guess I just have been extremely anxious, and that's probably why my optometrist told me to come and see you.
You have a lot going on right now, Roseanne, for sure. You recently had that stroke and you don't feel comfortable driving anymore with your vision, and you've got all these added healthcare expenses. It's a lot to take on, and I can, kind of sympathize with you there. And it's hard to realize that, you're losing some of your independence without the driving, and now you have to rely on others. And on top of that, having the trouble with cooking, that's very stressful.
I feel like everything's going downhill at once.
I can see that it's a lot, and it's kind of getting a little bit hard to manage for you. If you were to rate your sadness on a scale of 1 to 10.
Somewhere around 8 probably.
How about if your sleep? How are you sleeping lately?
I have terrible insomnia. I just feel exhausted all the time.
That's a lot to manage to get through the day too when you're very tired like that. How have you been eating?
Well, I don't have a lot of appetite, to tell you the truth. Ordinarily, if when I'm feeling good, I love food, but it's just not been happening lately.
So right now, out of all those things that we just discussed, what's causing you the most stress?
Definitely the transportation. I have so many medications that I have to pick up. And I'm going to have eye surgery, I think. I'm pretty sure. And my daughter maybe after hours, she can take me to get my prescriptions filled, but she's not going to be able to take me to all those appointments.
So in the case that your daughter can't bring you to pick up all of your medications, there is actually a bus service here in Big Rapids. It's called Dial a Ride. All you do is call their number and get ready to be picked up. They let them know where you are, and it takes about 15 to 30 minutes. They do charge a small fee, but I do have a pamphlet for you here. Just allow a little bit of extra time because it is just like a bus service, so you have maybe some extra people along the way.
Oh, that would be just wonderful. I've seen those buses around town. I didn't know they were for people like me. Can they take me to my appointments?
They absolutely can, as long as they're in Big Rapids. So they just have to, make sure you get picked up early enough. And another option that you actually have is through Medicaid.
Medicaid? That's my insurance. What can they do?
Through Medicaid, they actually do free transportation assistance as long as they're taking you to a medical or a behavioral health appointment. You have to set up the transportation 3 days in advance and explain that you're unable to drive and that you don't have anybody to get you there. And I actually have another pamphlet for you for that as well.
And that doesn't cost me anything?
It's covered completely through the insurance. I do have one more thing that I would like to talk to you about though. Okay, so I'd like to send you a referral to an optometrist who specializes in low vision rehabilitation, and they can work with you on finding devices that will help you with specific tasks. So we talked about you're having trouble reading your recipes and doing the knobs on your stove, and we can get you some devices to help you with those things. And they actually have a loan program where you can try out the devices before you actually make the purchase.
If I don't have to give up my cooking in addition to not being able to drive, I would feel so much better.
It's a very hard thing to do voluntarily, to give up that driving. But this appointment will help you use the vision that you currently have, and it will be used more effectively. So Roseanne, I'd like to see you again in about a week. And at that appointment, we can further discuss all of the extra stresses and things that you have going on right now and how to manage it.
Thank you so much.
You are so welcome.
Hi Roseanne, it's good to see you today. I'm glad you stopped in. I just talked to a nurse at your doctor's office about a week ago. We talked about your imipramine and how you may be experiencing some anxiety still due to some recent events in your life.
Oh yeah, my anxiety level has been pretty high lately. The doctor said he was going to call and prescribe some new medication that he thought would help. Also, I need your help picking out some artificial tears for my dry eyes. There's so many choices out there.
Yeah, it can definitely be overwhelming, so I'll go help you pick out some artificial tears, but I do have that prescription ready for you. So the new medication that we're starting you on is called sertraline. It's a medication that's going to be anti-anxiety, antidepressant, similar to your imipramine, but we're going to be starting you on that on 25 milligrams a day, once a day. And then next week, we're going to increase that dose to 50 milligrams a day, once a day. So that's going to be 2 of those 25 milligram tablets. Now, at the same time, we're going to start decreasing your imipramine dose. So this week, I'd like you to take 25 milligrams of that twice a day. The following week, I'd like you to take 25 milligrams of that once at bedtime. And then the week after that, we're going to go ahead and stop the imipramine completely.
That's a lot to remember. Is this really necessary?
Yes, we're trying to decrease the side effects that may come from starting one medication and stopping the other medication. So I know that's a lot to remember, so I wrote out a schedule for you as well, so you don't have to remember everything that I'm saying right now. And then when you follow up with your doctor in about a month, you can discuss with them how the whole schedule is going for you.
That would be very helpful. Thank you so much.
I have a few more things about the prescription that I'd like to tell you. So the sertraline, it usually takes about 1 or 2 weeks to kick in, and then it's going to take about a month or 2 for you to see the full effects of it. So please continue to take it, even if you're not feeling the full effects yet. And if you have any concerns about it, feel free to talk to your doctor or call me and we can discuss it. The other thing is you may experience some side effects for a week or 2 when you start this medication, but they usually go away after a week or 2. So you may experience things like nausea, headache, and trouble sleeping. I know that's a lot of information. Do you have any questions for me?
No, not about the new medication. If I do, I'll sure call you. I'm probably going to have some imipramine left. Can I bring that back to you?
Yes, definitely. If you bring it back in, I will be able to dispose of it properly for you.
Okay, I will definitely do that. I saw a social worker today, and she gave me some breathing techniques that are supposed to help with my anxiety. I hope they do, and I sure hope this new medication will help too.
Definitely. I really hope for you that the new medication and the breathing techniques together help with the anxiety. I also wanted to tell you, when I spoke with your doctor's office, they wanted me to remind you to stop taking your warfarin 4 days before your cataract surgery.
Oh boy. I hope I don't forget. I am so forgetful sometimes.
And that's okay. If you would like, I can help you to set a reminder on your phone to stop taking the medication 4 days before your surgery. A lot of patients use this method to either remember to take their medications or to remember to stop taking them.
Oh, that would be great. I have to start doing that so I remember to take all my pills.
Let me go grab those eye drops for you right now. So these are the artificial tears that I think would work best for you. What you're going to do when you're experiencing dry eye, you can put 1 drop into each eye, whichever one is dry. If both of them are dry, you can put it in both. You can do that every 4 hours as you need it. Do you have any questions about putting the drops in your eye?
Is there a technique I should know maybe?
It's not that hard. What you can do to help is lay down to put them in so that you don't have to tilt your head back and that you're laying down. Once you put the drop in your eye, go ahead and shut your eye for 2 minutes to let the drop sit and lubricate your eye.
Thank you so much. You've been so helpful.
Oh, you're welcome.
Well, Mrs. Smith, it looks like the cataract surgery went very well. I'm very pleased with the results.
So am I. I can't believe how much clearer everything is. Even the leaves on the trees look greener than they have in years.
That's wonderful. I'm very happy to hear that. I did receive a note from your social worker before the surgery about your difficulties with cooking dinner and reading recipes. I think with your new eyes, things should be much better for you, especially if we get you some new bifocals. But we can also set you up with some small magnifying glasses that have lights built into them. They're going to be great for picking up and quickly reading small print.
That'd be great. I'd like to give those a try. I think it'd be helpful.
You also meet driving standards today. Based off of what I'm seeing, you're legally able to drive again.
Oh, that is wonderful. I was very happy with that dial-a-ride service that the social worker told me about, but I am so happy to have the freedom to drive myself.
That's wonderful. When was the last time you saw your primary care doctor?
About a week ago. They've given me a new prescription, new medication for my anxiety, which has helped a lot. And I'm back on that blood thinner since my eye surgery. In fact, I've got to go and refill my prescriptions right after this.
Great, and I'll also let them know that you're done with your post-op surgery eye drops.
Great.
Hello?
Hello, can you hear me? I'm not sure my computer's working.
Yes, I can hear you just fine. My name is Jake from Dr. Smith's office. Am I talking with Roseanne?
Yes, that's me.
Yeah. Can I just get your birthday just to confirm?
Yes, September 22nd, 1945.
Perfect, that matches my records. How are you feeling today, Miss Roseanne?
Well, I think I'm feeling pretty good. I'm just kind of, I don't know, not real comfortable, I guess, with this, talking on a computer, but that's the only thing that's odd to me.
Yeah, totally understandable. I feel awkward too. How are your eyes doing adjusting at the cataract surgery that you had?
They're great. They are great. And my eye doctor actually prescribed bifocals that are just working wonderfully.
That's awesome. So I guess what I want to do now is kind of do some tests. And you say that everything's doing fine. Are you in any pain right now?
No.
No, okay. Just curious. But I would like to run some tests with any potential leftover symptoms that you may have from your stroke that you had last year.
You can actually do that over the computer, on the computer?
Yeah, you bet. Like I can already tell lots of things just from the way you and I are talking right now.
Like the fact that I need a haircut, maybe?
Yeah. Well, I don't know about that. I mean, your hair looks great. But in the meantime, are you ready to conduct some tests?
Sure.
Yeah. All right. So first one is, I got this here with me. Can you tell me what this is?
It's a pen.
Yes, we can write with it. What color is it?
Yellow.
Perfect. That is the right color. All right. And then I also have this wonderful picture here. Oh, if I can get this right. How many people are in this picture?
3.
3. Perfect. That is the right number of people. So for this next one, I was wondering if you can kind of move kind of a little bit closer to the camera, kind of stare into it, maybe a little bit closer to the screen. I know it might seem a little weird.
Like this?
But
Is this good?
Yeah. Yeah, just for a moment. I was wondering if you can close your eyes real tight for me. And then 1, 2, 3. And then you can go ahead and open them. Good job. And then I was wondering if you can look up for me. And then down. And then left. And then right. Good. Good, good. I was wondering if you can give me a big smile. Perfect. I like that. I was going to ask you to show your teeth, but with a great smile like that, I think we can just move on to the next test. How about that? All right. So I think the next one, perfect. So this next one might be kind of weird, but I just want to ask you real quick. Do you have any like tingling in your face? You know, when you're doing those tests or anything like that in the past while? Okay. Nothing into your arms or any numbness or anything like that? Okay. Good. Any weakness or dizziness? If you mind me asking, lightheadedness, anything like that? Okay. All right. Are you able to kind of tilt your head to your I guess that would be your right? That left?
Right?
Left. Yeah, you're right. Let's go you're right. You're right first. And then to your left. I'm going to try and mirror you. And then all the way back. And then all the way kind of tuck your chin a little bit. All right. Good job. Any pain with that?
No.
No. All right. Well, that like you said, that if there's no pain, you passed all my tests. Mind if we move forward and kind of talk about our plan for today?
Sure, yeah.
Yeah. So basically, what that was is called a neuro exam. You know, with your stroke that you had last year, it's one of those things where there's a disconnect between your brain and your body. And with the test that we ran today, I was able to check some of those things, and that was kind of the big part of the test.
So I was okay.
Yes. Yep. We're able to check the nerves and all along your head and your back. We didn't check all of them, but the way you're able to talk to me, Pat, the way you're able to tell me what the pen was and stuff like that, everything is okay.
Great.
Good. It was a pleasure to meet you, Miss Roseanne. What questions do you have before we log off the computer here?
I don't really have any questions. I'm glad we could do this.
All right.
Great.
Yeah. Same here. And like I said, if you do have any questions or concerns that come up, or if you feel dizzy or lightheaded, anything like that, feel free to call us. You know, because we're online, we might be able to get back to you a lot sooner. Okay.
Okay. All right.
All right.
Yeah.
All right. Sounds good. And maybe able to hopefully get an appointment for that haircut in the near future. Okay.
I sure hope so. Thank you.
All right.
All right.
In the meantime, you take care. Okay.